Dietitians play a big part at all stages throughout treatment. So at diagnosis, what we know is patients that are malnourished tend not to do as well. So dietitians will be looking for patients that might have had a lot of weight loss before treatment has started. Dietitians will also be on the lookout in a hospital setting for patients that may not have been eating well before their treatment starts. So, they might have been missing out on a lot of nutrients in their diet that can play into the equation for their immune function, for example. During treatment, dietitians will probably be most heavily involved, and that's really supporting people to maintain their nutritional status and be as well nourished as they can be and minimise the effect of some of those side effects. During treatment, your dietitian will be, at most treatment facilities, your dietitian is a member of the multidisciplinary team. So dietitians will be working really, really closely with the medical team, whether that be the radiation oncologist, the haematologist, the medical oncologist, and also the wider allied health team as well. So physiotherapy or exercise physiology often ties nicely with nutrition, but dietitians will be involved with any member of the multidisciplinary team that might be involved in that young person's journey, whether it be nursing staff, occupational therapy, psychology. Dietitians often will engage with psychology when there's a lot of the psychological issues that might be impacting on a young patient, and that might be impacting on their eating and drinking. So some of the emotional side of things, or emotional consequences, I guess, that might be playing a part in how that young patient is travelling throughout their treatment. After treatment, a dietitian will probably be most closely linked in with a patient's GP, is a good example, in terms of getting that patient back to, returning to, good eating and drinking habits for the long term. But I guess patients, if they're not engaged with a dietitian throughout their treatment, they certainly can request that. Most treatment facilities, if not all of them, will have dietitians on staff, and certainly for any patients that might be receiving private treatment, where there may be less resources for dietitians, there are ways to find a dietitian in private practice that might specialise in cancer, or they might not be a specialist in cancer, but they have had some training at university and would understand some of the requirements for patients with cancer and in the recovery phase.